tape it, and make it. Hello everyone! In this video, we will show you a taping technique especially for problems of the upper back in the area of the thoracic spine. We use 3 strips of our Kintex pre-cut tape. Simply tear off and stick on left and right parallel to the pane we will mark. At 90 degrees, we tape a 3rd strip. For this taping technique, our patient bends forward and makes the upper back round. Now, we release the 1st strip, divide the backing paper in the middle and tape it under full tension on the right side, parallel to the spine. Let it end loosely without pulling. Now do not forget to rub. We proceed with the 2nd strip on the left side, analogous to the first one, parallel to the spine. Stick it on under full pull. Let the ends run out again. The 3rd strip is taped under full pull, this time at a 90-degree angle to the first 2 strips, directly over the pain point. The ends are again loosely spread out. Now rub the whole thing once again. The resulting heat and pressure ensure that the adhesive strength of the tape is increased. When straightening up, we see a wave formation, which shows us that the tape was applied optimally. Thank you for using Kintex. Tape it and make it.